Hello everyone, my name is Teddy Duong and my topic today is on drug abuse. So, drug abuse is definitely a public health problem, and so in society, drug abuse affects all parts of society as this causes a strain on the healthcare system, the criminal justice system, and especially the economy. Addicts usually suffer financially as they can no longer perform at work or hold down a decent job. In 2014, over 43,000 people died from a drug overdose, more than any previous year on record. So, how does drug abuse happen? Studies have shown that drug abuse in the late childhood and early adolescence is associated with greater drug involvement. It is important to notice that the youth, however, don't ever progress on abusing other drugs. Socioeconomic factors can also be taken into account, such as gender, race, and geographic locations. So there are definitely a lot of etiological factors. Genes account for 40 to 60% of the risk for addiction development. Males are more likely than females to develop a substance use disorder. There's also differences in metabolic variations by race. Community risk factors involve drug use and misuse, continue to create public health challenges in the United States, such as leading OD deaths with a transfer and infection of HIV and hepatitis C, along with other chronic health conditions. Moving on. So, how to solve the public health problem of drug abuse? There's definitely there more than three strategies, but when you put it together, it all comes down to these three. So, parents can definitely use the information on risks and protection factors to help their kids or whoever they're involved with to develop positive preventative actions before the problem occurs. This can involve just talking to your kids about the dangers and the effects of using drugs, especially at an early age. Community leaders can definitely assess community risks and protective factors associated with drug problems that best target preventative services. Lastly, educators can strengthen learning and bonding to school by addressing aggressive behaviors and poor concentration. This is associated with a lot of risks that later can onset the drug abuse and health related problems. So, the United States has a lot of approaches to dealing with drug abuse and substance abuse, but other countries also face the same challenges and they have different methods and approaches to doing it. So, Chile, within their Spanish Ministry of Health National's Plan on Drugs, they have drug abuse campaigns that are eminently public instruments because it is seen as a positive propaganda for diplomats. So some diplomats base their entire campaign on just dealing with drugs and handling it, and it seems to be effective. Ukraine's approach to drug abuse, they use something called opiate agonist treatments, also known as OAT. There are widely used evidence-based strategies for treating opioid dependence and reducing HIV transmission. So there are a lot of positive benefits for OAT, which are strongly correlated with time spent in treatment, making retention a key indicator for progress quality. And this studies assessed patient retention and associated factors in Ukraine, where OAT was first introduced in 2004. So literature has a lot of uh, approaches and suggestions for dealing with drug abuse. First and foremost, it's basically just reducing the availability of substances in the community. So when you just reduce the accessibility for people to get drugs, it helps reduce addiction. Offering school-based programs that promote social and emotional competencies to reduce stress, expressing emotionally appropriately, and to resist negative social influences. This is really targeted towards the youth because um, they do drugs because of these factors, and it's usually seen as a last resort. So when the schools offer these programs to deal with these in the first place, it can help in the long run. And lastly, there's prescription drug monitoring programs, which should be in place to help monitor doctor shopping, which is a term used for when a patient sees more than one doctor to obtain multiple prescriptions. This is really important because it's really accessible to get opioids and all these drug related dependencies which are prescribed by your doctor. So when you monitor where these drugs are going and how they're being used, it can definitely help prevent addiction in the long run. So in my opinion, I believe it is important to explore proper monitoring techniques as mentioned before because prescribed drugs are easily addictive once prescribed. Additionally, proper medication disposal is also important as individuals should be educated on the appropriate and safe use of drugs and how to dispose them properly. These approaches can definitely help relieve drug abuse in the future and the present. So this concludes my presentation. Thank you for listening.